Hello, my name is Amy Hendel, and I am the Drug Demand Reduction Coordinator for the San Diego Imperial Valley HIDA. Our HIDA strives to educate and support the youth and communities of San Diego and Imperial counties, helping to create safe environments and promote policies aimed to reject the access and use of illegal drugs, alcohol, and tobacco, while promoting safe and healthy drug-free communities. We have key partnerships with the California National Guard, HIDA board members, and other community partners, which help us to achieve these goals. One of our most recent activities, which will be unveiled this month in partnership with the San Diego County District Attorney's Office, San Diego County Office of Education, California National Guard Counter Drug Task Force, and Center for Community Research, is the San Diego County School-Based Interventions for Substance Use and Overdose Prevention, a comprehensive guide to curriculums and overdose prevention strategies for schools and communities. It is my pleasure to introduce our next group of panelists who will carry forward our conversation on school-based prevention. The previous panel drew attention to 5 essential pillars of a school-based prevention system. This next panel will bring to life the various ways in which community partners can get involved in school-based prevention. Collectively, they represent perspectives from state agencies, community coalitions, and law enforcement. Our moderator for this panel is Mr. Carlton Hall, President and CEO of Carlton Hall Consulting, a multifaceted, full-service consulting firm. Mr. Hall has been providing intensive substance abuse prevention focused and community problem-solving services to the nation for the last 25 years. His responsibilities and unique set of skills and experience have made him one of the most highly sought-after instructors for community problem-solving across the nation and internationally. Our second panelist is Roger Dinwiddie. Mr. Dinwiddie has been the CEO of STARS Nashville, a nationally recognized nonprofit organization addressing substance misuse, school-based mental health, violence and bullying prevention training, and adolescent intensive outpatient treatment services since 1986. Mr. Dinwiddie was also the co-developer of the STARS Student Assistance Program, which was recognized in 2012 by SAMHSA's National Registry of Evidence-Based Programs and Practices. Our third panelist is Mr. Anthony Jackson, Director of Prevention and Early Intervention Services at the Tennessee Department of Mental Health and Substance Abuse Services. In this role, he oversees the continuum of substance use prevention activities, including managing the prevention portion of the Substance Use Prevention, Treatment, and Recovery Services Block Grant, administering federal discretionary grants from SAMHSA, and the Bureau of Justice Assistance, and overseeing the prevention allocation of state funds. Our next panelist is Ms. Lori Paisley, Assistant Commissioner of Coordinated School Health with the Tennessee Department of Education. Ms. Paisley's career in education spans over 30 years and started in special education as an educator, where she established a system-wide program for students with emotional disturbances. Since then, she has transitioned into district and state-level positions, working with Tennessee's Coordinated School Health Program. While working with students with disabilities led her to the field of education, Paisley's passion is school health and ensuring that students are healthy and ready to learn. Our final panelist is Lieutenant Pamela Revels, President of both the National Association of School Resource Officers and the Alabama Association of School Resource Officers. Lieutenant Revels has extensive experience at local, state, and national levels in training and curriculum development, serving as an advisory capacity as a subject matter expert and promoting law enforcement engagement in school-based safety and prevention activities. Locally, Lieutenant Revels supports her school system as a liaison for the SRO program and coordinator of the Lee County Sheriff's Office Junior Deputy Academy, a program she developed. On behalf of the San Diego Imperial Valley HIDA, join me in welcoming our panelists.
opportunities and resources for community partners in school-based prevention. I'm going to start off by just sharing that schools are a powerful space for prevention. By reaching over 95% of school-age children, there's true opportunity here. The goal of today's discussion is to explore how community partnerships can play a pivotal role in supporting schools to prevent substance use and promote the overall health and well-being of our youth. We will focus on the principles and pillars of school-based prevention that you've just heard from our prior panel, and that emphasizes a systems approach, multi-level strategies, a reliance on the best available evidence, and the importance of being data and outcome driven. Our panelists represent key partners across state, school, law enforcement, and school settings, each bringing a valuable perspective on how we can build and sustain comprehensive school-based prevention efforts. Today, we will hear from Tony Jackson about the role of state agencies, Roger Dinwiddie on the importance of coalitions and partnerships, Lori Paisley on the Department of Education's critical role in this, and Lieutenant Pamela Revels on the vital partnership between law enforcement and schools. I'm excited. As we were in the green room, we kind of got into a little bit of a heated competition that kind of stirred up from between Tennessee schools and Alabama schools. I'm hoping that we can bring it all in together here and focus on what it is that we have at hand. But I want to go ahead and dive into the conversation that we have. What we're going to do is we're going to provide questions to each of the panelists. I'm really hoping that this can be a conversation that we'll have. I really invite the panelists to engage each other as we're having this conversation, but also those of you who are listening, as questions come up for you, please put them in the chat and we will find the opportunity and the time later on in the presentation to be able to address your questions as well. This is a conversation and we're inviting you to join in. And so with that, I'd really love to start this conversation. Roger, I'm going to start with you, if you wouldn't mind, my friend. Roger, you've been working extensively within schools to implement comprehensive prevention strategies. Can you help set the stage by sharing what does successful school-based prevention look like from a coalition's perspective?
Yeah, thank you. So good to be with everyone today, especially good friends in Tennessee here today. I think, one of the things important is I was personally involved early on with the first coalition in Nashville, Davidson County, which was actually called the Nashville Network 2000, ultimately, which became the Nashville Prevention Partnership. What I would say, I got the perspective of being both a partner and a provider. And now, thankfully, through the support of Tony's office, the coalition that is now taking place in the Nashville area. So I'm really excited to have multiple perspectives on this. I had a few things to say that I think are pretty simple but straightforward as it relates to your question and to the discussion. And it's very simple. With over almost 40 years of experience of doing this now, there's some basic lessons about what does school-based prevention look like, and that's what I'd like to share a couple of those observations. One, primary prevention is necessary, but it's important for the partners to really embrace the primary focus of schools and remembering that at all times that it's the focus on academics and successful outcomes for students. And we serve a valuable role to be able to support in prevention what schools often can't do. So the coalition becomes a great partner in that way. Secondly, we need to understand our role as a community partner. So what does it look like? I can't answer that for everybody, but I can tell you what it looks like a snapshot for us. And that's, we do everything we can to help the school achieve its outcomes, their outcomes, while we focus on the social and emotional well-being of young people in that particular building. That is a shared goal and a commitment that is fundamental to what our role is as a partner and what the school needs us to do. The third, a third lesson is we really have to know what the school's needs are. So from a needs assessment standpoint, it's imperative that we have at some very basic level understanding about what we think they need based upon their feedback to us. We can't assume as prevention folks that we know best what that school needs. We've got to make sure we understand from their perspective what they need to do and what they want us to do. Finally, last, we got to make sure once we figure that out that we evaluate what we're doing so we can in turn understand if it's working or not working. So we need that partnership. Can't do this in isolation.
Roger, thank you so much for that perspective and kind of bringing that home. I'd really like to ask you kind of if you could crystallize for us. The last panel did a really remarkable job. They were talking about those pillars, right? And they were talking a little bit about the need for academic and prevention-based strategies. And they were talking about kind of the three tiers of universal, selected, and indicated prevention strategies. What specific activities within those tiers have you found most effective? Can you provide some examples?
Absolutely. I think it goes to say that it varies from school to school, which is really important, which is number one critical piece. But what we've found is without a team in the building to really help assess what that looks like, it doesn't work very well. So we need a team to help us determine. So from the standpoint, as an example, just last week, in universal strategies and whole school addressing that all population, one of our school districts had our high school leadership teams develop a strategy to work on substance misuse that they would be presenting to all the middle school feeder patterns within that school district, which is a great strategy to not only engage content, but also the importance of youth voice. Also, you look at whole school pieces. I mean, it could be, right now we've got Red Ribbon Week, we've got Project Graduation, we've got Bullying Prevention Month, which we're in right now, No Name Calling Week. You've got all those kind of things that can be extremely helpful. Also, you've got evidence-based curricula that can be used as well in terms of whole school delivery approaches, which could be provided not only by an educator, but also by a community partner. That's a way that we can actually provide through the coalition folks to help do those things that the school folks may not be able to do. Last year, I looked at our data. Just in our agency alone, we provided through our staff about 480 classroom and or whole school activities, reaching nearly, unbelievably, almost 100,000 students in the Middle Tennessee area through 11 school districts. So when you think about that, it's important to realize, and my last point is this: evidence-based curriculum is great. But if there is no relationship between the kids and that classroom teacher or co-facilitator or whoever that is, it will not be successful unless there's strong relationships that exist within that system. And then last, those services for tier 2 and tier 3, really what it boils down to, we had somewhere in the neighborhood of about 20 different sources of referrals last year, various issues. And those are the issues that those young people are involved, usually in small group or individual modalities. And then finally, last but not least, serving that more intensive services, as was mentioned in the intro, through mental health services and case management and therapeutic services. So a full array of those kind of things are important for a school to be effective in terms of its overall prevention strategy.
Roger, thank you for that. You've hit on so many extraordinarily important points. One of which I think that really kind of leapt out was the idea that there was a need to have some teams involved, right? And which speaks to that pillar of infrastructure support that is absolutely necessary. You talked a good bit about evidence-based programs that were essential and the need for partnering relationships. I would imagine that one of those extraordinary partners is the state and the state's role with respect to this. And so, Tony, I'm going to do my best Phil Donahue impersonation and come to you now, my friend. Phil Donahue, did I just reveal how old I am? I think I just did. Tony, listen, from the state perspective, what are the key goals and expectations that you have for school-based prevention programs? And how do you, in your role, support local coalitions and schools to align with those state standards that you all have prioritized?
Yeah, thank happy to be here. I will say, no, you didn't age yourself. I know who Phil Donahue is, and I feel like I'm young, so we're all good here. In my role at the state, obviously, I have to worry about my funders. It just like the people at the local level have to worry about the funders, the people at state level have to worry about the funders also. The best part about my job, though, is we have opportunity to work with great partners like Roger at the local. We have great opportunities to work with great partners like Lori Paisley that's also at the state. And so as we talk about working with people, it's something that we all deal with is how do you work with people? You have conversations. You don't just come in saying, this is what we're doing because I told you this is what we're doing. Just like Roger mentioned, kind of doing some type of an assessment to determine, hey, what is the need? And then, hey, how does the need align with the funding? And so when we talk about kind of goals and expectations, a lot of it is if you're willing to work with us, we're willing to work with you, right? We can find a way to get to yes, but let's have a conversation. Let's not just go off and do on our own. And so when we talk about stuff like that, it's how do we align the goals and expectations? A lot of it's data driven, right? Very simple. Again, just like Roger said, these aren't concepts we've not heard before. It's things we've heard before, but we need to really utilize them in a way in which we can all get on the same page. And so if we say, hey, there's this need, then I can say, hey, how does it align with our funding? And if we can do it with an evidence-based focus, because that's where all of our funding goes for, is what is evidence-based? And we can't just do it because of, for lack of better phrases, we try to age ourselves. I try to age myself younger. We don't just act on vibes, right? We have to have cold, hard facts that then we can align with the work. And so some of our expectations are simply put, well, if we want to use data and we want to have a conversation, we'll make sure we're on the same page. Let's develop a plan together. It's not my plan. It's really your plan. Now, sure, I make sure it aligns with what I need it to align with. But when we think about planning, a good thing that STARS does at the local level is, how does this look through the lens of the strategic prevention framework?
Yeah.
If we can align it with that, if we can go through the process of, Roger knows every year, develop a program plan. Hey, have our logic model, make it fit into a plan that shows we're not just doing this because we want to, like I said, because of vibes, but we're doing this because we think this will be effective in our community. Now, as we develop logic models, as we think about the strategic prevention framework, and as we go into expectations, going back to saying the best part of my job is, as we think about what matters to the state, how do we increase protective factors and how do we decrease risk factors? Simply put, that's all we are trying to do. And as you think about substance use prevention, some activities look like substance use prevention. Okay, it's education. It's an evidence-based practice that does all these things. And then also, some of these things do not on its face look like substance use prevention. As developing those executive leadership skills, is empowering the youth and young adults. Because as we think about data, and what we're seeing is the age of initiation in our state, while we're having a great trend in terms of substance use going down in our state for 8th, 10th, and 12th graders. That's according to my survey we do every year, which you can look at, Teen Together, TNMHSAS survey. If you Google it, you'll see it. We are seeing the age of initiation get a little bit younger, right? So what our data is telling us is, hey, how do we get into schools and how do we get that captive audience and how do we engage them in an effective manner? But again, go back to your question. All of that's answered by developing that plan, making sure we're all on the same page, and truthfully making sure I'm not just telling Roger what to do, because that's not effective. Okay. At the state level, it's really, relationships are so important. Even setting this up, the reason why I'm here is because Roger mentioned, hey, Tony maybe could be a good representative to talk about the work we do, because he's not just some person in the state that we kind of know or what. No, I see Roger all the time. He lets us come down to his building and have meetings there. It's having those relationships and being able to have real conversations, not the fake ones where, okay, we're all good and all this type of stuff, but really getting to where we can help people, because simply put, all of our jobs are the same. Every person on this call's job is the same. Well, my job is to help Tennesseans, and Revel's job is maybe to help Alabamians, if I said that right. It's very simple, but it's how do we do it? I think relationships, make sure we're on the same page, helps guide so much of that. I hope that's what you're looking for, Carlton.
Absolutely. You brought up so many points, excuse me. And what I would share is that one of the key things that you spoke to is that your efforts in providing guidance to local communities and your local grantees to be able to do and execute on evidence-based programs is by the data and being data-driven, which I would assume is vitally important for you at the state level. And so role that needs assessment plays with respect to this. And if you could you speak a little bit about what resources are available to help your community partners identify and access funding for your school-based prevention efforts?
Sure. So in our state, one of the big things that I believe in, truthfully, this is from leadership at the top, is how do we help people we contract with directly, but then also how do we help people we don't contract with directly? Because fact is people are developing or implementing effective programs and they receive zero funding through the Office of Prevention. Okay. And so to the data piece, one of the things that I feel great about being able to offer is student survey results. Okay. It's where every other year we survey 8th, 10th, and 12th graders across the state through many, all of the schools that Lori, not every school Lori has, but a lot of schools Lori has. And that helps guide as they think about applying for state grants, right? As they think about maybe funding opportunities like the DFC, Drug-Free Communities. As they think about the Opioid Abatement Council. Now, that's the biggest thing I think in our country that everyone can speak to. Now, all states do it differently, but specifically in Tennessee, we've got 2 types of Opioid Abatement Council funding. We've got the local level stuff and the state level stuff. Now, I'm not involved in that process, but I sure am involved in understanding what's there and how important having data, having some type of, is it technical assistance and support around your program in of itself? Is it providing, some workforce development stuff? Is it providing some resources around training in terms of efficacy of certain types of programs that then set people up with the ability to apply for those different types of funding? Outside of that, some other things that we do are we provide some technical assistance around grant writing. We offer through my office, a couple of grant writing courses. And then also, truthfully, Carlton, there are probably some things I didn't mention today, but going back to the relationship and going back to the conversation,
yeah,
we invite community partners to reach out to us and let us know what they need. Because I'll tell you right now, I'm in central office. I'm really in my home right now, but I'm in central office in Davidson County. I'm not all over the state. It's just, I'm not there because the way my office works is we contract with providers who do the work. And at the end of the day, I'll tell you first, I'm not doing the work. And so, what my job is how do I support those who are doing the work? And I think that perspective is so important because it allows you to realize that, okay, this is what I can do to help. And it's empowering for you. And it's also empowering for the people in the field because they are the ones who are doing it.
Agreed. It's vitally important. And you speak about the vital nature of these relationships, particularly with respect to community and coalition leaders such as Roger, but also I would suggest with your state agency partners. And so I'd really like to bring in Lori, if you wouldn't mind, to this conversation. Lori, the Department of Education plays a vital role, critical role in helping to set standards and making sure that schools are guided. Can you talk a bit about your priorities, the department's priorities for supporting school-based prevention, and how you partner with local schools and prevention programs so that they might better apply the principles and pillars that have been discussed today?
Absolutely. Thank you, Carlton, and thank you for having me here today. I'm honored to be at the summit. I've attended the previous sessions and wow, I have so many notes to put into action, but honored to be with my fellow Tennesseans and Lieutenant Revels, who's my fellow Alabamian, but to be on this panel, but to talk about coordinated school health. I don't know if any of the attendees are familiar with coordinated school health, but it's also known as the WISC model with the CDC. We do the same thing. However, coordinated school health has been in law in Tennessee since the year 2000. And so when CDC and ASCD, revamped the model to WISC, we wanted to stay grounded in the great work that we've been doing for so long, but still doing the same work. But coordinated school health has 8 components. Quickly go through those: health education, health services, nutrition, physical education and physical activity, healthy school environment, school counseling, psychological and social services, student, family, community involvement, and staff wellness. And we are so fortunate in Tennessee to have a coordinator of school health in every school district,
That's
not
amazing.
in every county. We have 95 counties. We have 147 coordinators of school health across the state. And just to barely scratch the surface, we're providing health education. You mentioned standards. We have State Board of Education approved health education standards and physical education standards, school counseling standards as well. But we're also giving preventative care through health services, our amazing school nurses across the state, ensuring a safe and healthy learning environment that includes the mental health supports, and informing and educating parents and staff. They're our greatest role models for our students.
That's extraordinary. These coordinated, these coordinated school health coordinators in their role, one of the things that I see they have a great link to is the fact that one of the things that the guide brings out is the fact that schools really are responsible for the entire continuum of care for young people and a range of issues and challenges for our young people. Could you talk a little bit about how you see those pillars of prevention aligning, forgive me, with the broader school health initiatives in the way that you support schools?
Absolutely. I think the first one that quickly comes to mind is infrastructure support. I mean, that is what coordinated school health is. It's infrastructure within that school district to provide that support for all of the schools within the district. But for coordinated school health, the team, the coordination and collaboration there ensures prevention implementation. And each district with coordinated school health has the qualified workforce within the district to lead their schools in strong policy, along with providing quality resources based on needs, much like Roger and Tony talked about, services and support and strong communication. You know, we have a system where we can communicate with all 147 coordinators right this moment. They can reach out to us and we are there to meet their needs. So infrastructure support, that is coordinated school health, but also positive school climate. Our division, the Coordinated School Health Division, administers the school climate survey. And this past school year, there were over 23,000 surveys administered to elementary, middle, and high school students, parents, and teachers. And we support districts and schools in the administration of that school climate survey, but also in utilizing their results to improve learning environments. So all of our students and staff feel safe, they feel engaged, and they feel supported. And then with needs assessment and monitoring and evaluation, our division at the state level collects school health data from each school district in all programmatic outcomes of all 8 of the school health components. But we also collect even deeper data in health services, physical education and physical activity, and school safety. And we utilize that to prioritize needs, what we do to support our districts and schools, but also to determine the impact of the programming and strategies being implemented in all those areas.
That's extraordinary, Lori. And part of what it is that I'm hearing in that is that this needs assessment, this is not, and being data driven, this is not a one size fits all approach that you all are implementing there in Tennessee. I would imagine that the needs associated with schools in your urban areas are very different from the suburban areas, are very different from the rural and the Appalachian areas and the like. Could you speak a bit about some of the challenges that you might come across in trying to help each of these schools execute on evidence-based prevention services?
You're absolutely right. It really varies from the largest school district. I mean, Roger and Tony and I are in Nashville, and Metro Nashville Public Schools is the second largest school district, but I'm sure you all have heard about Memphis. Memphis Shelby County Schools is our largest, and they have 222 schools. But yet we have school districts in rural areas. Some have 1 school, some have 2, some have 3. And so we really tailor all of our support for them. Obviously, Metro Nashville Public Schools and in Memphis Shelby County Schools have a larger workforce. They have a larger capacity, but we are partnering with everyone that is on that team that we have all referenced. And so we are able to tailor our resources and supports. In Nashville and in Memphis, you have so many more resources right there in your backyard. I will share that I am a former coordinated school health director in Putnam County Schools. It is, I guess, rural, but we had 20 schools, and in our region, the Department of Education has 8 regions across the state of Tennessee. In my former region, the Upper Cumberland region, with 20 schools, we were the largest school district out of 14 school districts within that region. However, those other 13 districts came to my home base within that county because that's where all the resources are. That's where mental health providers, a regional health department, a regional hospital are. And I love sharing just the beauty of those regions because we're a huge family, Coordinated School Health. But those 8 regions, it's almost like that's your immediate family and they take care of each other, but they do that using the resources that are there regionally. So as you mentioned, in an urban area in Memphis and in Nashville, there are so many resources, but we try to make sure that those resources that are within those larger urban areas are able to reach out and support those rural districts. And it really is amazing. And I'm so proud of our state because just mentioning health services and healthcare procedures, when you're in West Tennessee, Le Bonheur is a great supporter of all those West Tennessee districts. But when you go over to the eastern part of the state, Ballad Health, the East Tennessee Children's Hospital, they have their own strong partners within that region. And that's how we're able to make that happen, just in response to your question.
That's extraordinary. And one of the things that brings to mind is I would imagine that some of those areas are really being challenged right now in the aftermath of Helene and the need to work with respect to that. And so our hearts and our prayers go to all of those in Tennessee that have been affected by this and the other states. But the other thing that it brings to my mind is the fact that it's a perfect example of where partnerships with local coalitions can help fill the gaps as you all are trying to address these issues and these needs. And Roger, I would imagine that this is where you and the Department of Education often come into contact with each other. Could you speak about how coalitions help support local schools as they're trying to execute on some of the priorities that the state has mentioned?
Excuse me. Yes, absolutely. Well, and the other piece is not only working with DOE, but also with Tony and the department. So we're working with both under the coalition. And another piece to add to that, just teeing it up just a little bit, is the coalition also is extremely invested in our law enforcement community here as well. And I want to make sure I don't forget to say that they're a strong partner with us in terms of how their role is so critical towards the overall strategies that specifically the Department of Ed and Tony's office and the Department of Substance Abuse, Mental Health, those networks are so important to be able to provide opportunities for community partners to be engaged in this conversation and the direction. I think another piece to that, as it relates to the coalitions, is just being sure that we are truly engaging the partners. For instance, like Lori in her work, switching just from substance misuse, just within the last week has provided support to our organization to offer regional trainings that are provided by their office towards the prevention of bullying from the legal standpoint, called policy to practice. So we're doing the practice part and general counsel is providing the legal part. So a great way to partner together. And then thinking about how the coalitions work, because there's a coalition in every area, for instance, where we might work. For instance, in some of the other counties, not the larger ones that Lori's mentioned, we have great relationships, for instance, in Murray County and Rutherford County, some of the other counties that they'll bring those things together so that we're able to articulate the kind of services that those communities really need and find supports for them by engaging that community coalition at that particular level.
Roger, thank you for that, and thank you as well for helping to tee up. It brings me great pleasure to invite Lieutenant Pamela Revels into this conversation. Lieutenant Revels, thank you so much for being with us and supporting this. As a school resource officer and as the president of the National Association of School Resource Officers, you have a unique perspective on how law enforcement can support school-based prevention. Can you speak first and foremost, provide just a little bit of background and context as to who NASRO is, what is it that you all do and are responsible for, and how do SROs, how do school resource officers contribute to building a positive school climate and preventing substance misuse?
Well, thank you for having me today. This is a grand opportunity to show how we do partner and how we are working in our schools. And, you know, listen to all these incredible presenters today. I come up with 3 themes so far, and that's care, relationships, and collaboration. And I think that directly aligns with the mission of NASRO and school-based policing. And that brings us specifically to what we like to call the benchmark SRO. NASRO says, hey, look, that person that you put in there should be carefully selected. That makes a really big difference. And then they should be specially trained. And NASRO is a training organization. We have several curricula out there that looks at different pieces of the school environment for that law enforcement officer that may have never experienced that before. And that kind of brings me to my story that I wasn't even supposed to do this. I was doing athletic training, but the good Lord had a different thought for me. So in that direction, the conversation with my sheriff, when he asked me to be part of the sheriff's office, he said, hey, we're gonna, we would like you to be a deputy, but we gonna put you in the schools. And I said, well, I don't know what that means because I never had even a DARE officer. And he said, well, we'll figure it out. So 20 years later, this is where we are. And so that brings forth that carefully selected, because if they are authentic, if they are approachable, if they're doing things like building positive relationships with their young people, that builds trust. And with trust comes a lot of things. You can impact their lives as far as maybe they're having struggles at home. Maybe they're not getting enough to eat, and you can help with that. All the way down to maybe that they are having problems with being abused. So specially trained, understanding, and working in collaboration with your educators is so very important. So the triad that we build from is law enforcement, which gives that immediate help if you need it, especially when it's a crisis situation, direct a threat. But then you have what we like to call public education, public safety educator. And that really falls into the role, really what we're speaking to today. Us, number one, building those positive relationships and being able to go into the classrooms. And I'd like to just step off of what Roger said earlier. He's so right. If you have built those positive relationships with those young people, when you enter in that classroom and you're bringing information to them and you're saying, I care about you, and this is how I want to tell you I care about you. I want to give you really good information so when you go out and you need to make critical decisions in your life, maybe you remember the things that we talked about. And so that's the impact that you can have, bringing forth the evidence-based anti-drug programs, anti-bullying programs, all sorts of prevention programs that you can go in. And some folks, they work with their local counselor. I know we use some Title IV funds to help us do this, So that it's a combination of what you're talking about, the coalition. It brings everybody together. But to make that next step, not even being into the classrooms, then you have that third piece to that triad, and that's mentor and informal counselor. Again, bringing in that positive relationship. You can also be a part of that PBIS that's going on in your school. You start with tier 1, right? You're going to provide that anti-drug program for everybody and those other programs. But that tier 2, maybe it's a little bit more. You have that young person who may be struggling. So sort of the PBIs with your SRO is, picnic with Deputy Pam. That was mine. So if they were good, they put parameters on it. So if they were good, they got that little special attention because we had a really good rapport, and that's what they really work for. So it's the incentive that you can be in that type of situation. And then all the way up to, tier 3, where you can also help with intervention. That's what I tell folks all the time. Prevention, intervention, and response. It's one of our greatest values that we can offer because we have the time to really put forth a little bit more than some of our educators because they are so busy educating. And so that's a little about us in a nutshell.
Lieutenant Revels, thank you so much for that. And thank you for providing just an extraordinary picture of the role that SROs can play. It actually kind of really sparked some thoughts for me and some ideas for me moving forward that I might not have considered. The role that they play in cultivating those relationships between the students and those evidence-based prevention programs that are expected to be implemented. You're kind of like the glue oftentimes that can help a student to engage. Dr. Christina Bethel, who provided an extraordinary keynote earlier, really spoke a lot about the importance of young people mattering and feeling as if they matter and knowing that they matter within the school context before any of this can begin to stick with them. And so I can connect the dot between the SROs and the effective implementation of evidence-based programs and practices within schools happening. Thank you for all that you do. I'm going to actually ask our friends at ADAP to help us out. I really would like to open this up now for audience questions and see what thoughts they have. I'm hoping that you guys have not just been listening, but actually that some ideas have sparked for you all. And so, Patty, if there's some questions, or David, if there's some questions that have come up in the chat, please share that with us now.
Hey, Carlton, it's Laura.
Hey, Laura.
Hey, all right, excellent panel. Thank you all. We do have several questions, and the first few are really related to the Tennessee Together survey. And so these are directed towards Lori. We've got some questions coming in. Number 1, from other states, can you share the Tennessee Together survey in some way, shape, or form, or can they see what that looks like? And maybe Tony, you can help with that. And then number 2, beyond just accessing it, we've had a couple, I guess, that are there in Tennessee, and they're wondering if it's something that maybe could be standardized across school systems so that the coalitions can access that data. Thoughts?
So yeah, I'll tell you that, Lori, I got you. Yeah, we both made a face. We're good. So Laura, that's a good question. And so in terms of sharing the survey itself, yeah, sure, no issue. It probably should be on the website anyways. I will talk to my person, Matthew Parrott, who's our PIO, and hope we can get that up there soon, because it is on the web as we're implementing our 4th administration of this. We're up to 8 years now because we do it every other year. And that's a core component of as we seek to get people interested in the survey and participating, because in our state, We require active consent, and a component of some of the recent laws is providing opportunity for parents to read the survey before they sign off. So we're obviously following everything to be on board. In terms of standardizing across systems, Lori and I have had some conversations about this in terms of what we've done or not done. I will tell you, in terms of where we are structurally in our state, the way we've gotten this survey to be in these schools, in survey 21,000, I think that's the number on the site, 21,000 kids in this most recent period, is having those substance use prevention coalitions work in the districts and the schools in their communities. And I hate to be this way, but it has been a lot of one-on-one type thing. Hey, work with one at a time. And Lori, I don't want to put you on the spot, so I'm not doing that. But I think that's been the reason why we've done it this way is that's kind of the most effective way to get it rolled out, because I'm not sure we're in a position to standardize it across the state. Do you have any maybe feedback on that, Lori? Not to quiz you while we're sitting here right now.
No, totally fine. My first initial response is we in Tennessee are surveying students in schools a lot.
Right.
And we at the Department of Education are trying to not, survey schools too much,
Right.
but this is so important. But to Tony's point, working one-on-one with that contact within the school district, which many times are coordinated school health directors,
Exactly.
is the best way. I shared earlier that some of our larger school districts, 222 schools, but then those that are smaller, 2-3 schools, the coordinated school health director has many different roles. And also each school district has a different school board, a local school board that guides what can and can't be done in the schools with our students. But I think what we've all talked about, even in the previous panels, relationships are so important. And many of our school board members are parents, and they may want to know the information that Tennessee Together gives them to guide what they're doing moving forward to support our students being healthy. So I think Tony's right, that one-on-one and the strong relationships and sharing that information of why are we surveying, but I'm not sure, I agree with him. I'm not sure that we would be able to do that statewide, but we're always working with Tony and his agency to ensure that we're able to get it done.
Yeah, no, and that's good. I always worry, Lori, if I start talking, if I'm saying the same thing someone else is thinking. So good, we're on the same page. We're hitting out the park today. And to Lori's point, it is that one-on-one, because fact is my whole belief is we talk about relationships and think, but if you think about what is a relationship, it's people who have either common theme, common goal, or have a way to work together. And fact of the matter is if you're not in a place to do something, I do not want to make you do it or force you to do it, because guess what type of results do you get when you do those type of things? Or how do you just turn off people and lose them? So a lot of us, for me, is where can we get it? And if we can, great. And if we can't, you know what? We're going to do this in 2 years. My team, my people out in the field, I know because they tell me, they'll work on, hey, informing and showing, hey, how this here's our data is helpful and all this to get them where we want to be in the future. But just because they're not there right now, that's okay. Because fact of the matter is, if we survey 21,000 kids and it can be generalizable to the population of the state, we don't have to survey every kid. We like to, sure, but you don't have to. You can do statistical analyses and all this stuff. Don't worry, I'm not doing it. My evaluator does them to get it to where it makes sense and can be generalizable to the state.
Thank you. We've had a slew of questions come in, so I'm going to try to consolidate some related to SROs. And basically, these questions surround, number one, how do you even get them engaged? Number two, how do you fund them? And then number three, how do you, what are the different ways in which they're being used beyond curriculums or things that you've already mentioned, Lieutenant Revels, which is primarily focused on that in the classroom experience, but what are other ways they might be being used? So how do you engage them? How are they typically being engaged? How do you fund them? And then how do you use them?
So the engagement part, I think I have a little bit more elaboration on that question, simply because when you say engage, I mean, getting that SRO to do these type of programs in the classroom and things like that. Well, first off, you have to understand, if you go back, you look at anybody, public speaking is one of the greatest fears out there. And so law enforcement officers generally are not public speakers. And so to tell them they're going to have to go in front of anybody, even if it's a bunch of third graders or fourth graders or fifth graders, it can be a little of a daunting task. I know we do approach this in our basic curriculum, and that's, how to be in that classroom management, how to set up a class, and making sure that you run that through your agency as well as the school system before actually going into the classroom. So there's a lot of pieces to that. But I think you really encourage them. I think that also goes back to that interagency agreement, which is called a memorandum of understanding. And with that, it really lays out what that officer should be doing on that campus. And so if there's a bit of an expectation there, then that's one way that our schools can sort of approach them, say, hey, we would like for you to come in and help us. Would you come in and maybe work with our counselor in the very beginning? Or if you have, that teacher that has something, or schedule something that they really have a really good understanding about, such as we have a lot of law enforcement officers who go in and they teach some forensic science classes, which the kids love, because what do they see every day on TV? CSI. And so one thing we get to express to them is crimes aren't solved in an hour. And so we get to kind of go through that. I know through my background with athletic training, I've went in and talked about that as far as our healthcare classes, because there's a lot of different avenues that you can do when it comes to healthcare. And even I've done a taping session with them, like ankle taping. So they really enjoyed that. We do what we call an driving awareness program, where we're focusing on not drinking and driving, and that kind of moves into the distracted driving, and we use specific equipment, we use goggles, and it's a very interactive type of course. It's outside. So there's a lot of ways. I think the primary thing would be, first off, what does your MOU say? And then talking to that individual, if they say, yeah, and encouraging them and starting them at baby steps into the classroom.
Wonderful, thank you. And did you mention how they are typically funded, SROs, coming into the schools?
So across the nation, that really varies. I know there are many states, I think Tennessee is one of them, that really have put a lot of funding into their SROs. And then there's states where it's really that school system and law enforcement agency working together, maybe even a 50-50 split. There's some places where that law enforcement agency will fund it all. I think it's really dependent on state, and then where it goes down to even the district level and that local law enforcement agency. So I think it varies. I think you look at your state and see what's out there. I know in Alabama, again, Title IV Part A, there is some pieces in that some of our school systems have used to help with some SRO funding.
Thank you. I find this next question extremely compelling because I've never heard it asked before. And I am very curious what your responses are to it. Many times, high and low functioning students get resources. I've never figured out what to offer the average student. Sometimes they feel disregarded. They may fall into substance use because they may not have been caught with a universal strategy, or they may not be in those risky, more advanced substance use stages to be in the high risk beneficiary of resources. I was one of those students, says the participant. So how can we think about the average student?
Well, let me add one comment. That's a great question. One of the things that I know we believe strongly about is leadership opportunities. And that becomes such a great place for young people who are, to use that word, in that middle space of they're not on either side of that issue. So leadership opportunities, increasing youth voice. And I know in our schools we have that we work with as a provider and a partner is we have leadership teams in those buildings. And that could be anywhere from a small school, a few people, to a large school where some of our schools have 30, 40 people. And they're from a broad cross section of the school. So it's not all kids who are at the top of that pyramid, if you will, in terms of their social status. Training those young people in how to have positive youth voice is such a great opportunity. And I know one of the pieces too, particularly around the issue of bullying prevention, is to engage those young people in how to step up and advocate for their peers and colleagues around that important issue. So that's one thing. And I want to just add one quick comment back to what Lieutenant Revel said. We've talked a lot about relationships and trust and all those issues. And before moving on, I want to, at least for me, add this piece that what it takes to have a true partnership under everything we've talked about, I believe, is in fact solid relationships and trust. Because without those things, you can't make any of this work. And secondly, you've got to have buy-in at the building level. And I don't think we've said that very loudly. So if administrators want us to be there, two things have to happen. They have to provide leadership opportunities and opportunities for training and resources. And then as the partner, really critically, we have to be dependable, accountable, and responsible. If we say we're going to do this, we got to be there and do it, because that's the expectation. I think that's what happens when you have strong relationships and you get an opportunity to work, because you can't do strong things for even student voice and leadership without a strong commitment on the part of school to make that happen.
Thank you. Coming into the chat was just a remark about whoever asked that question, and you know who you are, about the average student. It really drew out and resonated with our audience members. So thank you for that. Panelists, I want to thank you for taking the time today to apply what the audience has learned about in the school-based prevention guide and really draw in your own experiences and share those with us. You know, sometimes forming these collaborations is not easy. Recognizing the opportunities is often missed. And Carlton, once again, just a beautiful job leading us through this discussion. Thank you so much. Lots of praise coming in for the panel, especially you, Carlton. People are happy to see you up there again. So I want to thank you all for joining us today. And at this time, we are going to be breaking for lunch. We'll break for an hour, and then we will return and see you at 1:15 Eastern Time. Thank you.
Thank you all. Thank you all. You guys were great. Thank you so much.
Thank you.